I'm Dr. Dana Udall-Weiner, and I'm glad you're joining me today. Family-based treatment, also known as FBT or the Maudsley Method, has received a lot of attention in recent years, and for good reason. So far, data suggests that it is the most promising therapy for adolescents struggling with anorexia. And there's reason to believe that it's useful for treating adolescents with bulimia as well. But there are some downsides, and it isn't right for every family. Today, I'm going to provide you with an overview of FBT. I'll tell you what it looks like and explain how families use it so that you can get a realistic sense of how the method works. I'd like to start out by outlining some of the fundamental ideas behind FBT. The first is that parents are central to their child's treatment. When the FBT method was first developed at the Maudsley Hospital in London, it was considered revolutionary because it focused not just on the eating disorder child, but on her family. Unlike other methods, which tend to see the family as part of the problem, FBT is founded on the belief that parents do not cause eating disorders and that parental involvement is essential for recovery. This means that it is parents, rather than mental health or medical professionals, who are on the front lines of treatment, working with their children every step of the way. The second idea has to do with the etiology of the eating disorder, or the factors that cause the eating disorder to develop. And on this issue, FBT doesn't take a stance. In fact, the reason for the eating disorder is almost irrelevant, since the focus of treatment is on reducing symptoms. This means that there's no one blamed. Parents aren't considered to be the source of the problem, nor is the child. Instead, the family is encouraged to band together to defeat the eating disorder, rather than to engage in battle with their child. You may be familiar with this approach because it's often used with alcoholics or drug addicts. It's the addiction, rather than the person, that is seen as problematic. Separating the person from his or her drug addiction, or in this case eating disorder, helps family members avoid the trap of blaming their child, and it keeps them focused on working together to defeat the eating disorder. The third idea behind FBT is that the eating disordered child is seen as regressed or underdeveloped for her age. FBT assumes that the adolescent is not in full control of her behavior because the eating disorder has taken over her life. As a result, she needs her parents to step in and take control of her eating, at least in the early portion of treatment. As the method's developers explain, the parents are temporarily put in charge to help reduce the hold this disorder has over the adolescent's life. Once successful in this task, the parents will return control to the adolescent and assist her in the usual negotiation of predictable adolescent development tasks as appropriate. Another fundamental idea is that weight restoration is the first step in eating disorder treatment and must be accomplished before psychotherapy can begin. This means that initial therapy sessions focus almost exclusively on helping the parents refeed the child. Dealing with other issues, such as conflict in the family, is put on hold. Once the refeeding process is well underway and the child is adequately nourished, topics like these can be addressed. And finally, the last idea I'd like to mention has to do with the setting in which the eating disorder treatment takes place. In family-based therapy, inpatient or residential treatment is not considered to be necessary or even preferable to keeping an adolescent at home. This is partly because parents are seen as such a valuable resource, but it's also because inpatient hospitalization may not be effective, given that patients are frequently discharged before they meet their goal weight, and because they often relapse and must return to the hospital for additional inpatient treatment. Hospitalization is thought of as a short-term solution, whereas family-based therapy aims to provide lasting results. So what does FBT look like?